This is my part 2 of my video. I have already done my, my suctioning. I made sure that my patient was oxygenated. I made sure that he didn't have any further questions and that he was comfortable, of course. And then I am now going to be, of course, he knows who I am. I am Jania from Nevada State College, and I'm going to be with my professor, Professor Rachel. And of course, I have checked his wristband for his first and last name and his birth date and make sure that he doesn't have any allergies. Of course, I'm raising the bed to a comfortable position for myself. And then he has to be in a 30 to 45 degree angle. And again, I have assessed him, he's good, all right? So what I'm here now for, my patient, is that I'm going to be cleaning his cannula, okay? So I'm cleaning your cannula, and I have my kit here, and I would like to always bring 2 just in case something goes awry. And so this is my tracheostomy kit. It is a sterile kit. I'll be looking at it and making sure that it is not expired and there's no you know, breakdown of the packaging or anything like that. I also have my, it would probably be either normal saline or some peroxide, hydrogen peroxide that could be deleted. That's going to be for cleaning. So I would come in, I would have my privacy and all that, and I would make sure that I have my hands are hygiene, very clean hands, okay? So now that the patient is ready to go and he knows what's happening, I'm going to go ahead and first loosen my, first I make sure that this is not expired as well, okay? Everything is good. It's a brand new one. I'm going to loosen it so I can easily open it. So these are loosened and ready to go, okay? So the next thing I'm going to do is open my sterile package. Okay, so I have a pair of sterile gloves in here, and I'm going to don my sterile gloves. Now this procedure is kind of half sterile, half not, because it's impossible to be completely sterile at all times. But my right hand is my dominant hand, so this is the hand that's going to be sterile. Okay, so I'm going to don my sterile gloves. By cupping my thumb. Everything tucked in here. Okay, this is all done now. Okay, patient's going to be here on my left. Okay, so I'm going to take this little sheet here. This is like a little, just going to keep my sterile field here, and it is a 1-inch border. We want it to open up. Okay, the shiny side is going to go down, and there we go. It's not perfect, but it'll be fine. It's because I'm not going to touch that outer edge. Okay, so now that I have my sterile gloves here and I have this here, I'm going to remove the items that I need from my kit. So these are my bottle cleaners. I don't want to turn my back on my sterile field. Okay, I've got 4x4 gauze. I've got bottle cleaners. And then I have a fenestrated gauze here as well. So I'm going to set that aside. I'm going to need that in a moment. And then I have a little strap here. And here's my bottle cleaner. Okay, so now that I've set this up, I'm going to go ahead and take the lid off and put it face up, and I'm going to hold on to the label here with my palm. The label is in my palm, that way when I'm pouring I do not drip anything to mess up the label. So this is going to be according to the provider's orders. Not sure exactly what he wants, but there's some peroxide there. It can be diluted. And then there's also the normal saline. We'll be pouring that in, putting the lid back in. So I've got my fluids in my little container here. Okay, so now what I need to do is take my inner cannula out of my patient. Okay, so here it is. This is my patient's cannula, and I'm going to take it out if I can. I would be taking, it would be in the patient's, you know, neck, and I would be taking it out with my, the hand that is the non-dominant hand. This is still my sterile hand. Okay, now what I'm going to do is I'm going to make sure that I hold it right there so that I try not to touch it, and I don't touch the inside or anything like that. Okay, so it's going to go in, and I'm going around my sterile field. It's going to go in the solution to be cleaned. Okay, so now that I've done that, I'm going to go ahead and get my cleaner. And I will be picking this up on the outer edge here. And I will be going inside the cannula. And I will be going on the outside of the cannula and making sure this is really clean. I'll be disposing of this. Never want to get anything wet on my sterile field, or else I have to start all over again. So once I've cleaned that, I'll make sure that I rinse. Okay? So it takes about 20 minutes for the cannula to dry. So at that time, I would be putting it down to dry, and I would be putting it down in a sterile field, and then I will be starting my cleaning. Okay, but for the purposes of this video, I'm going to go ahead and put this back in. All right, so I have it back in the patient's. Of course, I don't have a mannequin, but it's going back in here. Okay. And now I'm ready to do some cleaning, okay? So I'm gonna put this back down. This is my patient. And I'm gonna go ahead and do some cleaning. So what I need to do now is I still have this sterile hand. And I'm gonna do this, dip in my Q-tip. I want to go underneath here. This is the stoma. I'm gonna clean around the stoma, behind the face, behind the shield here, the plate. Dispose of this, get another one. There should be another one here. I would get another one, and I would dip it in the water, and then I would go around on the outer area here. I would go between 2 and 4 radius, okay, making sure that that is good and clean. Okay, and then I would take the gauze, and I would be dipping it in my solution and cleaning this plate here. Okay, all good and clean. Everything gets disposed. Okay, this is really no longer a sterile technique, so this is all clean. So then I would be, now the next thing I want to do is I want to take my strap here. It's going to be Velcro or like a shoelace. It actually looks like this, but for the purposes of this video, I have this because it fits in this homemade fabulous thing that we did. So we would go around here, and I'm leaving the old one in, okay? So the patient's strap is still in, and I'll tell you why, because we don't want to take a chance of this popping out. So that could be a big problem. So we always want to keep one finger there to keep it in place. And I'm going to be attaching this strap. Once I have the strap attached, I can take out the old strap, okay? Taking out the old strap, that's gone. And now I'm going to test that I have 2 fingers here, because we don't want it to be too tight, okay? Because I also need to leave some space, because I'm going to take this now. This is a fenestrated gauze 4x4, and we're going to place it underneath here to protect the patient, So that makes it a lot more comfortable for the patient. And of course, I'm always asking him or her if he or she is doing okay. Is everything okay? How are you doing? If they seem to be in distress, I would make sure that they have enough oxygen, all that kind of stuff. And then so now this is all done. Okay, so now I can dispose of all my equipment. I would take off my sterile gloves, dispose of everything, okay? I would do my hand hygiene, okay? And then I would ask my patient if there's anything else that he thinks or she thinks that they might need at this time, if they want the bed lowered back down. It is a good idea to kind of bring it up because that gives more oxygen to the patient to keep the head of the bed a little bit elevated. But then I would, because I'm tall, I would have to lower the bed down to the lowest position again, raise the rails, make sure that my patient has his call light, because if he has any distress or any discomfort, I would want him to call me right away, okay? He's gotten through it all now. I feel good about that. He feels good about that. And I'm going to tell him that I'll be back within an hour to check on him. If there's anything else he needs, please give me a call. And again, I've thrown everything away. I perform my hand hygiene, okay? And then I have left the room.